Hello, my name is Rohan Kumar. Thank you, Mr. Mass, for helping me with my presentation on nuclear energy. I'm going to ask you some questions about this topic.
Fine.
What level of nuclear radiation can harm you?
What level of nuclear radiation
Can harm you.
Well, it would be hard to come by, but usually it's well known that in the range of about 300, what's termed 300 rads to the whole body, or 300 gray, would be a point at which the body would start demonstrating acute effects to the radiation, as in an effect that will show up in a brief period of time. Greater exposures than that, and the severity of the effect certainly becomes much more pronounced, as well as it complicates more body systems.
Okay. What are the short-term effects?
Short-term effects. From a large dose of exposure, the very first syndrome, as we refer to them as radiation syndromes, that you will see is called prodromal. In other words, you would feel like you were coming down with like the flu, a little queasiness, a little nausea, maybe a slight fever. But higher levels of exposure past that, past about 50 to 100 rads, you're going to start seeing, in a clinical laboratory, you would start seeing changes to the white blood cells, primarily to the chromosome structure because of the radiation injury that they've received from photon radiation. Again, passing that level of exposure into what we term the hemopoietic syndrome, those parts and tissues in the body which are actively producing red blood cells, white blood cells, because really there's a stem cell or a precursor, call it a mother cell, from which all other cells are developed. Well, that very maternal generational cell would suffer the most consequences. They would start to be depleted, and the immediate effect would be in like a week or two, you would see a drop in an individual's white blood cell count. That becomes a problem, of course. I see that video has disappeared again here. Let me try that. That becomes a problem, of course, to the person who's trying to recover from that injury. So medically, we would try to put them in a clean environment, a sterile environment, so that we don't compromise their immune system and their chances of recovery. So we're looking at seeing some effects of radiation with as little as maybe 50 to 100 rads, but we're seeing very severe damaging and what's considered a lethal dose at 350, certainly 400 rads. And lethal in the sense that it's estimated that 50%, 1 out of 2 people in the population, would not survive that level of exposure if they did not have medical intervention. Hopefully I provided you with enough detail, and
yes.
Follow up with any other question you need, certainly.
What are the long-term effects?
Well, I work with radiation, so I'm considered a radiation worker. Like X-ray technologists would be, my other physicists in radiation therapy and here in the hospital, technologists in nuclear medicine or nuclear cardiology services are also radiation workers, which means that in our careers, we are allowed to employ radiation. It's expected that we would be exposed to some level of radiation, but our limits of exposure are very, very small. I mean, we're allowed maybe 5 rem, or what's called 50 sieverts per year of exposure. And at those levels of exposures, we have not seen, and I don't mean we as in Hartford Hospital, but I mean we as a professional group and amongst the different professional societies, we have not seen serious adverse effects to our working groups. The X-ray technologists have worked in X-ray since the 1930s, and certainly since the 1950s moving forward, exposures in those groups has been very, very small. Technology has improved. They're able to do X-ray imaging with a lot less exposure than what a patient had back in the 1950s. The nuclear med techs, the nuclear cardiac techs, they get, in our medical environment, far more exposure per person in a given year than the X-ray technologists or the radiation therapy technologists, because they're handling materials that are radioactive. They have to inject it, they have to transport it, they have to do quality control on cameras. So altogether, what we view as long-term or the delayed effects of radiation could be, hypothetically, cancer of various sorts, leukemia, skin cancer, bone, etc. And going back to the 1920s, when X-rays were first being used and generated with such precision that they could be employed on people, it was quite unfortunate that the early users of X-ray systems were the ones that had the greatest level of exposure, and amongst them, the radiologists were known to be a working group that had a higher risk of cancer, skin cancer, leukemia, primarily those two. But if we move forward again into the present day and age, you know, our professional societies have not seen amongst the working personnel anything which would lead us to think the poor health that they're showing is in any way related to radiation exposure. So in a very long way and roundabout way, I've just said that we have not seen any demonstrable effects of radiation to the working populations in medicine.
How can we prevent nuclear radiation damage?
Okay, in the hospital setting and where we work, the radiations, of course, we want to control them. So what we'll do when we're handling patients or working with patients in an implant or in a diagnostic study, we'll use shielding. Like in the syringe that we might employ while we inject a patient, there will be a syringe shield to minimize the radiation that's spread out, that goes into the room and interacts with other people. In the therapeutic side, like in radiation oncology, where we have much more amounts of radiation being employed for treating a patient, well, there we might not always be able to get by with just shielding, so we'll isolate the patient in a room, in a hospital ward, where there'll be limited contact with that patient during their treatment time here. So that allows us to control their exposures. But at the other end of the spectrum, if we look at industry like nuclear power and Millstone, they're dealing with nuclear energy in massive amounts and quantities of radiation. So they have to exercise very strict control over their work and their work routines, where they can go, how long they can be there. And in the industrial section, there are many alarms and ways to alert the staff when something strange happens, when what's termed the background radiation level in their work environment has increased. Alarms will go off. If radioactive gases leak out of the container that has the uranium fuel, the reactor, again, alarms will sound off to tell people, okay, we have to control our environment, escape, or rather, not so much escape, but exit the building so that exposure is not a problem for the staff there. And in between, of course, we have different levels of radiation protection. So we minimize our exposure with time, distance, and shielding. We reduce the amount of time we spend working with radioactive materials or with sources of X-ray. We use shielding if at all possible. We have thick shields that can be employed at the patient's bedside for those radioactive implants. We cannot wear thick shielding because it would be extremely heavy, But certainly we do have shields that can be moved to the patient side. And lastly, the issue of distance. By maintaining our distance from a source, we reduce the exposure tremendously. For example, let's say that you're standing 3 feet away from one of those syringes in nuclear medicine. And just for having a number, let's say that while I'm 3 feet away, my body is receiving 10 MR per hour that I stand there. If you double the distance and go 6 feet away, it's actually an inverse of that distance. In other words, 1 divided by 2. I doubled the distance, so it's 1 over 2, and then squared. So a half times a half is 1/4. Now that 10 MR per hour I had at 3 feet is now 1/4 of that, 2.5. So it's a dramatic reduction. Nothing strange about it. Your lamp there in your bedroom and in your house living room does the exact same thing. It sheds light. The further you get away, the less the intensity of those light photons striking the body. And the same occurs with radiation. So time, distance, and shielding, we can control a lot of the exposure and reduce any likelihood or possibility of having some damage to the human body.